Hello there, everybody. Thanks for joining us today. I'm just trying to let you all in, or Max's, I should say. So as you're gathering, it's nice to have you all attend our meeting. Thank you very much. And as the title suggests, we're going to be talking about the NHS app and getting ready and how we can support that with Exon Health's Intelligent Care Navigation System. I'm standing in for Lucy today, and as Lucy would normally say, please let us know that you can hear us all okay, either by putting a 1 in the chat or even just a smiley face. It's up to you, but it'd be nice to know that you can all hear us okay. Thanks. That's lovely. There's everyone in, Max. You still letting a few in?
Yeah, still letting them in, but let's crack on. Yeah, we're 2 minutes past 10, so let's keep going.
Today, what we're going to be looking through, really, we've got just a quick agenda for you. We're going to give a bit of a national context into sort of why we're looking at demand and capacity across the whole system, look at the NHS app and what's been said about it in the 10-year plan. We'll then look at the GP and the PCN contract requirements ready for the 1st of October. And we're also going to obviously look at some of the Exon Health products across our intelligent care navigation system, and also look at how we're really trying to support the critical access into general practice. And we'll end on some key takeaways. And obviously, if you'd like to put any comments in the question and answer section, please do. And I'll try and answer them while Max is giving his demonstration today. So first of all, the national context, Max, did you want to deliver this one?
Yeah, absolutely. Thank you. So I just want to give an overview, not to teach anybody to suck eggs, but we really want to understand the why of the reason for why we're doing what we're doing. And we know that there's been an increase in demand, and that's due to aging population and workforce shortages. And what that's causing is if you'd like to just click through, Sharon, I don't have access at the moment. If you'd like to click through as we go, that'd be helpful. So what that's causing is a lack of access due to obviously workforce shortages and aging growing population. Lots of you would have seen me present this on our roadshows at our events and certainly on a few webinars before, but that lack of access is leading to delayed care of our patients and citizens, and that delayed care is resulting into those patients or citizens presenting at hospital. And we know that secondary care, a visit to a hospital setting is a lot more expensive for the system. So on average, a GP appointment may cost the system £35 or so. A hospital, a patient presenting at hospital actually costs around £300 per visit. All of those patients ending up in hospital, whether they go there first through lack of education on where to go, which service to access, or they're going there because their problem has exacerbated because they haven't been able to get appointment in general practice or community service. For whatever reason, they're presenting in secondary care, and that's adding more pressure on the system, more economic strain, but also a reduced quality of life for those patients and citizens. And where those resources are being used up in secondary care, it's not enabling us to do the preventative care, which then compounds the issue of the increased demand that we're seeing within primary care. And at Exon Health, where we're really focused is as you see on the right-hand side there, that big orange circle, is the lack of access. So if we can improve access at a primary care level, and we'll go into the 10-year plan in a few slides' time and show how we're strengthening our neighbourhood working, our community work, to improve access to specialist services or improve appropriateness of GP requests coming in, we can actually free up humans within our surgeries to do the more preventative and proactive care. So again, reducing the need for those patients to access the service at all, or certainly present in a secondary care setting.
Thank you for that, Max. Sorry, just been trying to admit some more people as I go along. Max, I'll take it. You'll take over the admitting of people while I just go to the section here. Yeah. So we've probably all heard already about the national priorities for the 10-year plan: hospital to community, sickness to prevention, and obviously analog to digital. We're very much sort of making sure that we cover all aspects of these national priorities. And you'll see as we go through the presentation that actually a lot of the products that we are looking at today, including obviously the NHS app and all the services that are already underway in general practice, that we are trying really hard to deliver all this to our patients. We've got lots of work to do. We know there's a big gap between the sickness and prevention. And the tools that we try and put in place are not really just putting tech in for tech's sake. It really is to try and release that time back into primary care so we can start working on the more preventative processes in general practice. Of course, we know that if we can get from the analog to digital, which many of us are working towards and trying to bring our patients with us, that actually we can try and then make sure that we've got some digital solutions to actually improving that preventative care as well. So as we just go through, looking at initially, start of all with the NHS app, we know NHS England have got this vision now that they want the NHS app to be used as a digital front door going forward into healthcare. Simplifying processes and releasing the pressure on general on services as a total, because we know now as well that secondary care information is also accessible through the NHS app. It very much aligns to the NHS long-term plan, and of course the 10-year plan as well. A lot of you will be aware, and I hope that many of you as patients, it'd be interesting to know actually if people are already registered with the NHS app themselves in general practice, because I often get people saying when I talk to them that no, they haven't even registered for themselves. So it'd be interesting to know what people think. If anyone hasn't got it at the moment, might want to put that in the chat and maybe a reason why. We know the core features, repeat prescriptions, GP appointments is growing definitely in the NHS app as more practices are getting a bit more brave and being able to present their appointments in the NHS app. We know it's not perfect as to how you can select it as a patient, or I mean I've seen some sort of appointments been labelled that it's sort of size, you know, day 1 GP 2, something like that, means nothing to a patient. And also I've seen some called a group meeting, which wasn't actually correct for the patient booking in. So I think how we use our GP appointments and display them in the NHS app is really important to work on as well, and you know, get some best practice. Let's start sharing that learning. We can also reach out to the online consultation tools and actually look up referrals as well. What we want to really try and get to though is to increase the number of patients using the secure messaging system, which we now know will go to the NHS app first as opposed to using text. We still have a follow-up with all of the text, of course, at the moment, just for that sort of safeguarding. We want to be able to really sort of look at how well we can use the NHS app going forward, and there is a future roadmap that's in the 10-year plan, and you can see some of those key features here. Wes Streeting did describe the NHS app as an NHS app as the doctor in your pocket. I would like to sort of reframe that really, because I think it's the general practice in your pocket. As we all know, really, sometimes and many of the times, patients don't actually need a doctor, which we've sort of realised ourselves looking at the data we're collating through our digital assistant. You can see some of the new features there that are coming along, which we'll probably do a deep dive into those as they become available. We are looking all the way through to 2028 with some of these features here. So that's just to give you a flavour of what's sort of really coming with the NHS app. Missed that one. We've obviously got some GP contractor requirements, which if you have any messages or any sort of like thoughts about, please put them in the chat section. I think we all know that we've now got to have our online consultation open from the 1st of October between the hours of 8 a.m. and 6:30 p.m. That came around a lot of queries about safeguarding, about urgent queries coming in, and I'm sure the online consultation suppliers are looking how to sort of resolve that issue. What you really need to do for the 1st of October is your routine appointment requests, admin requests, anything that sort of a patient could do themselves, I suppose, really with self-service. And if you're not one of our digital assistant customers, you'll know that our sort of product right at the front end allows you to navigate patients to other services, allow them to self-service as well, and will teach them and train them on how to use the NHS app for whatever they're coming into the digital assistant for. The relevant safeguards here that they've put up to say that, you must meet those safety standards. It is a case of like, how do we make sure patients don't submit something that could be urgent and get left? Because I think it's sort of like a 72 hours return time on these routines. And of course, by using the digital assistant, we've got the AI element where the patient can type in their concern, and we can actually direct them much more simpler and navigate them through there. So we'll talk about that a bit later. There's also this about the patient charter. I don't know if anybody's actually had a look at this yet, or if there's an example that's come out from NHS England. I haven't found it yet myself. I don't know if people are starting to put together this patient charter that should be available on your website. But again, a very interesting one to look through as well to see what they mean by that. But it should be ready for the 1st of October. So if any of you are doing it, and again, share best practice would be really, really helpful. There are some PCN contract requirements as well, and that really is that a patient should be able to book across the system. So, you know, with your extended access services, how are we getting patients to book into those other organisations? There is a requirement for you to set up GP Connect, and I know we did a lot of that work with the 111 booking. So that's probably in place in a lot of areas. But again, really good to know if everyone's up to speed on that and sort of aware of what they need to do. So I'm going to hand over to Max. He's going to talk you through what the Exon's Intelligent Care Navigation System is and how it can support what we're doing today. And again, please put any messages or comments in the chat and I'll try and answer them while Max is presenting. Thank you.
Thanks, Sharon. And I think it's worth noting that as we work through these lists of slides, it's all in support of the direction of travel of the 10-year plan and where NHS England want to take this and the problems we're trying to solve. So we're on a journey together, and these products shouldn't be seen as conflicting products. They're actually very much working in alignment with each other, and we continue to develop in line with NHS England and the direction of travel from a strategic point of view. But then also we can bring that into a local surgery point of view. So one thing that we pride ourselves on Exon Health is building everything right down to surgery level. And that means whether it's a patient pathway, whether it's an internal workflow, how you're working, a process, whether we're moving from analog to digital within your surgery, we want to work with you at local level. So as I go through this diagram, it will change locally. We know there's local nuance in general practice. And again, we pride ourselves at Exon Health on working with you to meet that local nuance of general practice. And it's one thing that we've done, have demonstrable experience of in deploying Surgery Connect to more than half the country over the last 18 months. But as we build out this intelligent care navigation system, that is very much the cornerstone of what we do in our offering. So we're looking to work with you as a surgery or as a PCN or an organisation. So the intelligent care navigation system offering that we're offering is a layer of protection that we're presenting. So in light of the 1st of October contract changes, we appreciate that over the last several years, you've adopted, whether it be via the DFOC VC funding, or the Digital Pathways funding, you will have adopted an online consultation platform. And we know that at the moment there's a bit of concern, speaking to many of you, there's a bit of concern that if you open that from 8 in the morning till 6:30 in the evening, you're not going to have the human, the power behind it, the capacity to manage the influx of demand that's going to come through in a written form. So what I mean by that is an online consultation form is submitted, whether it's clinical or administrative, comes into your staff, and your staff have to manage that. What we're here to do is to present a simple solution to ease that pressure and make sure that you can abide or meet the contractual requirements by the 1st of October. And as Sharon's alluded to over the several slides previously, that includes online consultation submissions, clinical and admin, it includes cross-org appointment booking and routine appointment booking. So one thing that I'm demonstrating on this slide here is that if you add a layer of protection to the front end of those requests coming in, such as a tool like Surgery Assist, and I'm going to show you a video in a moment of exactly how that would sit, we can understand exactly where the patient needs to go. Now, this might not be a service within general practice. We actually know that 20 to 25% doesn't belong in general practice. It actually belongs now potentially in a community service, a local VCSE, for example, or self-service, which is a big one. And what I mean by self-service is NHS App, ordering prescriptions, viewing test results, changing an appointment is secondary care, which is now possible through the NHS App, or a simple signpost to advice and guidance. So combining all of that by understanding what the patient needs when they access general practice, whether it be by the phone, whether they walk in, or whether they visit your website, if we add a tool like Surgery Assist at the front end, we can make sure the patient gets to the right service. We can also make sure the patient gets to the right tool, whether that be the app. So trying to weave it into our conversation around the NHS app and the 10-year plan and the move to digital front door. One thing that I speak about this a lot because we've spoken to patients and citizens, 85,000 patients that we surveyed across Bob ICB just 2 years ago, just short of 70% of them, so 67% said that they would have used a digital product to access their healthcare services if they knew which one to use and how to use it. So the problem we have at the moment is just the lack of education around which tool to use. They've got an online consultation platform, they've then got the NHS app, they've then got their practice website and of course their practice phone number. By adding a layer of protection, understanding the patient intent at the front end, we can then allocate the resource appropriately or spread the demand appropriately, not just through your surgery, but across the whole system. So if they need to go to a specialist service in the community, we can signpost them away. if they need to go to the NHS app and learn how to order their prescriptions on a weekend, they can make that request on a Saturday through the NHS app, and Surgery Assist will help them do that. So for the last 3 years, I would say, with the development of the Surgery Assist product, we've done a lot of automated care navigation at the front end, understanding what the patient wants, signposting the way, or where it is a clinical request or an admin request that goes into the surgery, we tend to partner with those third-party OC products to submit a clinical request. Now, what I'm going to show you on the next slide is the ability to submit an online consultation request, clinical or admin, via Exxon Health new OC forms. Now, the beauty of this and what you'll see is I'm going to demo it in, sorry, don't skip forward yet, Sharon, sorry. Back, yeah, that's it, just, yeah, hold on. So one thing I just want you to understand is that we're working with the digital infrastructure across your health system, whether it's an ICS, whether it's your PCN, however you're operating. So we will use the NHS app, we will use your OC tool if it's needed. But what we're here to present today is how we can support 100% of patient demand coming in not only from 8 till 6:30 in the evening, but actually 24/7. And on the third bullet point down there, I talk about eliminating the ATM rush with 24/7 access and time-based routing. So we no longer need to turn Surgery Assist off. Well, we never had to turn Surgery Assist off. In hours, out of hours, weekends, bank holidays, we never have to turn it off because it's got the time-based criteria routing within it. It knows the time of day, it knows the day of week, and it knows which services are appropriate to signpost to. For example, if you've got an enhanced access hub, it can signpost there. If a patient makes a clinical request, needs to speak to a GP at 7 p.m, your Surgery Assist will signpost them there. If it is 3 p.m. in the afternoon and they want to make a clinical request, Surgery Assist can now submit online consultation requests into the surgery, all coming into your Surgery Connect phone bar. So one thing we're here to do is just alleviate any panic or pressure or strain of you having to open your online consultation tool for requests for the full 8 till 6:30, because by eliminating 40% of that by automatically signposting it elsewhere, it'll allow you to manage it in a more appropriate way. So I will just share my screen for the next slide. I've sped it up. So I've done a quick recording and I've sped it up. It did take me 2 minutes to do, but I've sped it up into 1:12 for you all, just to show how we can take patients from Surgery Assist, where the patient wants to make an urgent request, we can surface the online consultation form that Exxon Health is now offering. And I should stress that this online consultation form can be submitted via text and soon to be via voice. So if you are a Surgery Connect customer, of course, this intelligent care navigation system is our full suite of products, seamlessly integrated and deeply integrated with your clinical system as well. So if I just take over and share my screen, Sharon, and I'll click play. So this is the text interface for Surgery Assist. This is not using voice, of course, but this is a text interface where a patient might come into general practice. And just let me know if the video is moving now as we click through. It should be moving. So I've gone through to ask a question. I've gone through to the free text element of, in this case, ARIA, our demo environment. And as a concerned patient, I've mentioned I found a lump in my breast. It's just asking me to confirm, again, staging environment. I've noticed a breast lump, and then ARIA I'll pause it there for a second so you can read the full response. ARIA will then say, actually, this can't be dealt with in the community. This is something that we think you should come in and certainly request an appointment for, essentially. And what ARIA will then do, once you click that link, is surface our new Exxon Health OC form for clinical requests. And I can click through, I can state that this is for myself. And as a user would, meeting all of the NHS look and feel and the guidance to do patient verification. As a patient, I can confirm. We are also asking whether it's a new or existing condition, so keeping in line with continuity of care, or bringing back the family doctor is the way it's been branded and marketing out there in the headlines. But by logging whether it's new or existing, and I'll show you off the back of this how it's received into general practice via your Surgery Connect interface or your phone bar, and then actually we can assign that to the doctor that previously saw that patient if needs be. In this example, it is a new problem that I'm going to give an example of, and I'm just going to go through and explain my symptoms so that they're all received and brought through into my system. And again, this will be able to completed via voice as well very soon. I don't have dates for you yet, but what we're moving past at Exxon Health or beyond is right service first time. We're now moving to a situation or a platform where we can offer the right service first time, how the patient needs it, whether that be voice, text, via a website, out of hours, in hours, we can do that. So there's a quick example of the patient interface and how that will work. And then what you can see here is I've basically launched this from my Surgery Connect phone bar. I've now got this forms tab on the left-hand side, and I can see all of the inbound forms which have come in to my waiting list, and I can see my request that's come in. I can see how it was submitted. So this was an online submission. This wasn't an AI voice agent that came through Surgery Connect. I can communicate back to the patient in a myriad of ways, as you can already do from Surgery Connect, whether you want to invite them for a video consultation, simply send a text back, or even just call them. I've got this mapped to the patient there, so I can click through to the patient record. And of course, over here, I can find out if there's another GP that I want to assign that to. I can add internal notes, and then I can move that through to the triage list. And if I go through to triage, I've then got my doctors waiting on the inbound, and then I can, again, once my care navigator has dealt with it, my GP, perhaps if that's how you're set up, my GP can then review it and speak to the patient and make a clinical decision on whether they want to invite them in for a meeting, for an appointment or not. We've also built in the ability to log incomplete forms. So this isn't just via text. Again, this is via voice. We have what we're looking at in the market is where other solutions are out there in the market. Lots of patients might be frustrated. There may be a technical issue, but the call may drop. Now, what we certainly want to do from a clinical safety perspective is be able to clean up all of those incomplete submissions. So any incomplete submission that comes through, because we verified who that patient was at the start of the process, we can then pick up all of the incomplete submissions. And that might be that we want to call the patient if it's urgent, or simply send them a text back to finish off their form. And again, we can go through that with them on the phone if we'd like to. And then we've also got a list of the closed once we've gone through and closed them off. So there's a quick snapshot of what's coming in terms of the online consultation requests. But again, this is what we're moving to from as Exxon Health. So we know whether you have the phone bar, you're a Surgery Connect customer, or you're not, you will have the phone bar or navigation bar that will be launched onto your browser, and you can now use this intelligent care navigation system, phone system, Surgery Assist, AI-enabled digital assistant that is available via voice or text. Then also you've got the functional elements where patients can actually submit requests, and that's what will help you achieve the contract requirements by the 1st of October. But it's a really important distinction to make that we are not saying surface this form on your website. So I'm just going to bring up actually the web version of that just to make sure it's very clear. We're not saying put a big banner at the top of your website, allow patients to click here between the hours of 8 and 6:30 p.m. That's the real concern, and that will cause you lots of stress within your surgery. And you may be thinking, how do I hire in time for this? It's, I don't want to bring in more GPs to just, monitor inbound requests. I've got people on the phones that are managing them. How am I going to manage this in terms of capacity and demand? We're suggesting, please do not put a big banner on your website and allow people to freely submit. Add a layer of protection with a product like Surgery Assist that is trained with local knowledge and time-based criteria routing to move it along, to signpost those patients away and move them along into a service that is better suited to those. Sorry, Sharon, I'll take it back to you quickly on the next slide.
Yeah, that's brilliant. I'll just share my screen again. That's sharing okay?
Yes. So one more piece that we have in development at the moment is, of course, the routine appointment booking. Sharon alluded to cross-organisational booking, routine appointment booking, and I've just quickly grabbed some screen grabs that we've got in development and moving through to pilot mid-September. So whether it's natural language or a patient clicking buttons through the chatbot interface, patients will be able to go through, select an appointment, and actually book routine appointments as well. And of course, as I opened my gambit with, is we are hyper-focused on the local nuance of general practice. We will work with you to make sure we're surfacing the right appointments and making sure they're appropriate for the patients to book before they can book it. If it belongs in the community, we will signpost patients away. We want to free up capacity in general practice to make sure that we're solving that delayed care or access problem that I covered in the first slide of the show. Sorry, Sharon, back to you. And just before we move on, Ellen, do you want to, I think we've got Ellen on the call. Do you want to just drop a link in the chat? So if any of our 54 people that are with us today want to submit a request and learn a bit more and have an in-depth demo with the team, they can do that as well by completing that form. Thanks, Sharon.
Thanks, Al. That's great. I think really we were just going to do a run through. I can see we've only got sort of 4 minutes left to really sort of talk about the rest of the products. So if you were to fill out that form, you can see on here all of the functions and features of each of those products there. So as Max said, we've got Surgery Assist, which is a 24/7 tool for patients. We've got Surgery Connect on there, which is the phone, which is the telephone system. But we are saying that our Surgery Assist product and Intellect product actually and Insights are sort of system agnostic. They don't require Surgery Connect to work. But you'll see lots of other options coming under Surgery Connect that we're going to try and make available as well to all non-Surgery Connect customers. Surgery Intellect, some of you may have already put yourself forward for a free trial. We are offering free trials at the moment for Surgery Intellect, which is powered by Tortoise, the ambient scribe technology. And also Insights is our data dashboard. I don't know, Max, did we put a slide in for the dashboard? I can't remember if we did in the end, but
I haven't, but in the essence of time, I'm quite glad I hadn't. Yeah.
Okay, so there's some of the products there that we're just sort of talking about today, and it's how they all fit together. And I am going to hand over to Max for this next one because it's how it fits together in a more visual sort of flow around that intelligent care navigation system that I really think tells the story, and also the future step with regard to that voice and the proactive care. So Max, would you mind just taking on this slide and I'll click through it for you. Yeah,
not a problem. So in summary, we have much more. This is a very high level view, but in summary, we are aware that 84% of patients that require GP assist or general practice assistance call in at the moment, and we know that a large amount of that comes through Surgery Connect. So by way of size, we're managing at the moment 40 million telephone calls every single month. And interestingly, between the hours of 8 and 12 on a Monday morning, we're processing 5 million calls every Monday from 8 until midday. So Surgery Connect is the product or technology that is in use for that. And then what we've developed, brought into the intelligent care navigation system is Assist. So Assist is your AI-enabled, locally trained care navigator that works 24/7, available via text, soon to be voice from Surgery Connect. But that supports receptionists and care navigators with reduced demand, but also supports patients getting to the right service first time. The latest product or solution we've added that you should all be aware of is Surgery Intellect. As Sharon pointed out, we've partnered with Tortoise, one of the highest clinical grade AVT solutions in the market. So Intellect is there to support clinicians at the moment, later to be other roles within general practice, but support clinicians in summarization and SNOMED coding of clinical consultations. And then one thing that we haven't touched on today, but I'm sure there'll be many webinars and a launch soon to be announced, is our AI voice agents that we're building in to support not just national services and signposting patients doing generic proactive care, but actually working with local organisations to work on your local enhanced services. An example of an AI voice agent for preventative care or might be one project we're working on at the moment is out in Norfolk. We're aware that they are one of their local enhanced services is for TB vaccinations. So actually we're starting to build out agents with some GPs in those areas to support invitations for TB vaccinations across the East Anglia. So hopefully, again, this is very high level. If you'd like more information, a bit of a deeper dive into this suite of products, we'd love to meet with you and our sales guys can get together. We originally have a 60-minute demo, but actually, if you'd like us to cut that down to 30 or lengthen that to 1 hour 30 to cover it all, we can certainly do that. And more importantly, and the thing that drives everything in the middle of this and center of this is our Surgery Insights dashboard. Version 2 is going to be released in September, which is just further enriched with lots of data. We know there's been some changes with the NHS App data of late, which has been moved into the federated data platform. We've updated all of our data feeds. So now that is all available within Surgery Insights as well. So you can draw some insights into how you're performing in terms of NHS App uptake, usage, and where the introduction of these different technologies is help solving your access problems at your organisation. And is there a takeaway slide, Sharon? Did we get to that? So just to wrap it up, the contract changes, they happen every year. They can be quite stressful. You think you've got your workflow solved, then a new contract requirement comes in and you start to panic, being squeezed financially, potentially in your local region. We have to think innovatively. So we're supporting you as our partners, as contributors to primary care in the system that we're all part of, right? We want to work with you and help you think innovatively. Does this problem require a person, a technology, or a combination of the two? We make those decisions by looking at data. So products like Surgery Insights can support us with that. And there's also nationally available data. We bring it all into Surgery Insights, but you may not want to use GPAD data. You may want to use local appointment data. We want to work with you on that. So let's really understand the demand against the capacity you have. And then analyze workflows. So I spoke with you about how patients access general practice. Why do they access it? Do we need to do an education piece? What do we need to align on to make sure that we can support seamless patient pathways? And then, of course, with you, what we want to do is strategize. So we can show you some products that we have. You may have some existing products. One thing that we're very good at, and I'll stress it again, is working with you, understand your digital infrastructure against your digital strategy and helping you align that. Because it's really important to note, you may not need to go and hire 3 more care navigators to manage the influx of OC requests come in. At a 6th, 7th, 8th of that cost, you might just want to put a little digital product in front, but build it and deploy it with us to make sure that it fits your patient demographic and actually the reasons they're contacting you as a practice. And then, of course, communicate with patients and stakeholders within the surgery. We've got all sorts of templates to help communicate with different members, whether it's your PCN board, whether it's your reception team, and of course, whether it's your patients. And then going through the deployment phase, we're very much hands-on. I proudly have been saying this for the last 3 months. Our biggest team at Exxon Health is our customer success team. So we have a full team there on hand, not to only help you design whilst we develop these products with you, but actually in the deployment of it and that post-deployment. And when I say post-deployment, of course, I'm talking about point 4 there, which is iterate. It may not work first time, but if you're armed with the data and some support from us in terms of being experts to support you, then we can iterate that process, tweak a few pathways and make sure that we're solving the problem that we set out to do. But I said it on a call last week with a PCN lead in Leeds, we're not just deploying technology solutions, we're deploying solutions that are aided in part by technology. And that's really important, I guess, a really important note to take on. So yes, we want to support this easy transition. And I think I just noted in the chat that we want to support you to meet the 1st of October contract changes, but we want you to help do it with ease, less panic, and in a cost-effective way, because we know we're being squeezed, and we know that if you do have capital or resource, we want to spend that on preventative and proactive care to make sure we can actually reduce the problem that we have that we shared at the start of the slide deck.
Thank you, Max.
Sorry, back to you, Sharon, to wrap it up.
No, that's great. I think, yeah, we've 4 minutes over. Thank you very much, Max. That was really sort of interesting to see sort of where it's all going. And I think the big takeaway for me, actually, which we probably missed off there, is that equitable access that actually these products do bring in for patients. So whether they are able with their voice or, they want to use text, or they want to walk into a surgery, we sort of offer that sort of how whichever way they want to come in. As Max said, it's whichever way the patient wants to come into the services, which I think is great. And we've got so many other services that are outside of primary care that we need to educate patients on how to get to them. So I think that's been a really great session. Thank you very much for attending. I can see Al's put in the forms for the free trial as well for Intellect. And also, if you just want general information on any of the products, please select on the link above. And if so, we'll be in contact with you. And if you have any questions, feel free anytime to send them in to myself or Max. Email addresses are on the last slide there. So we don't mind at all. Any conversation you want to have, we're ready to have it. So thank you very much. Thank you. Bye.